The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life, for Tuesday, February 5th, 2019. Wow, we're ripping through February already. On the program tonight, we're going to be talking a lot about podiatry and the foot with Dr. Michael David Sassine. We're also streaming live on Facebook as well at All County Healthcare, INC, so type that into your browser. And after the show, this interview will be up at allcountyhealthcare.com. So once again, the guest tonight is Dr. Michael David Sassine. He's a DPM, and he's going to tell us a little bit more about that. But Dr. Sassine, how are you doing this evening?
I'm doing good. Thank God I'm doing good. How about yourself?
Great. Thank you. And thank you for joining us on this adventure of health, because we always learn so much from the doctors. So sure. You're actually local. You're a native South Floridian. Your practice is in Lighthouse Point. Yep. I normally start a little bit about the doctor's areas of interest, but tell us a little bit about your undergrad, medical school, residency, and then what brought you back to South Florida. Tell us the location, too, because I know you did some time up in New York City, and we have a few New York City listeners in this area.
I did. So I went to Florida Atlantic University. Go Owls.
Oh, me too. I'm 07. Multimedia journalism.
I'm
there we go. Go Owls.
Nice.
I can say that because we finally got a good football team. Well, this last year wasn't that great. The year before.
Honestly, with you, I never went to any game.
Yeah. Well, you're busy as a podiatrist running a practice. But that was your undergrad.
Yeah, that was my undergrad. I went to FAU, and then I went to Barry for podiatry. And
Barry University in Miami?
Yep, in Miami Shores.
Oh, Miami Shores, nice.
And then afterwards, I did residency in New York, the Bronx in particular.
Whoa, was that a busy residency?
Oh, yeah.
St. Barnabas.
Yeah,
I've heard of that hospital.
In the Bronx. It's over 100 years old.
Wow.
Yeah, it's a very old hospital. Afterwards, I graduated, and then not even one day after, I came back to South Florida, which was where I grew up.
Were you missing it, or?
Oh yeah, definitely. Yeah. And I was just tired of driving through snow.
Yeah.
It's
New York City can be rough.
It is rough.
Yeah.
Yeah.
Weather in this country in general can be rough as you go north. Definitely watching what's going on in Chicago. I know it was snowing in New York City the other day, if not today as well.
Not missing it.
Yeah, not missing it. So tell us where you're originally from in South Florida.
I was born in Plantation, but then I pretty much lived all my life in Hollywood, Florida.
Okay. Nice.
Yeah.
Why'd you decide to come back after residency and start a practice back in South Florida? You're in Lighthouse Point now, which is right around the corner here in Broward County.
So after just going through many winters 3 times in residency, when I did the 3-year residency up in the Bronx, I was like, yeah, you know what? I think I am gonna like it better back home in Florida, and things are just cheaper also compared to New York.
Oh, yeah.
And I don't know, I got a lot of accidents when I was in New York.
Yeah, that
I don't
traffic.
know, like, it's the traffic, and also I'm not just used to all the icy roads. So,
You had a taste of it, and now you're back in South Florida.
yeah, I was done.
Well, tell us about your practice here in Lighthouse Point. What are your areas of interest, and a little bit about your practice? I'll give out the location here in a bit.
Yeah, sure. So at my practice, it's called Sassy Feet.
I like that. It's clever.
Yeah. It's funny. It came from a friend that actually used to make fun of me a little bit about it. If I ever had a place called Sassy Feet. So
and you did.
You know what? I just stuck with it. I was like, yeah, sure. So we do pretty much everything at my place: wound care, traditional foot and ankle stuff, which involves heel pain, plantar fasciitis, treating fungal nails, which is known in the medical term as onychomycosis, athlete's feet. We do custom-made orthotics for patients who are with any heel pain or bunions, hammer toes,
ankle sprains as well.
Ankle sprains, we treat that as well. Pretty much any foot and ankle pathology we try to do. We try to also do awareness about any skin lesions of the foot. So we try to encourage patients in the office to ask your doctor about having a biopsy performed.
Does that go into diabetic foot as well?
It can. Sometimes if a patient has a ulcer that has been there for a long time, how I like to do things, I would like to take a biopsy just to make sure there's nothing there other than just a
see where it's going, right?
Yeah.
If it's on a path to no good.
Well, I mean, just to make sure if it's a chronic ulceration, it could be something cancerous. So we just like to rule that out.
And with the diabetic foot, that rubbing can keep on going. It'll keep on going all the way down to the bone.
Oh, yeah. It can get even worse and get gas gangrene if, if left unchecked.
And that, you don't want gangrene once it gets to that point. That's pretty tough to
Absolutely.
treat. You want to get it at an early stage. So if you have any issues, the website is sassyfeetpodiatry.com. I love that. I'm actually on it right now. I'm going to spell Dr. Sassine's last name. And actually, let me give out the website. So it's sassyfeetpodiatry.com. It's SASSIFEET podiatry.com. There's a ton of info there. Is Dr. Michael David Sassine. He joins us. He's a DPM. So are you board certified in podiatry?
I am.
Okay, tell us a little bit about that, how that works.
So you do a board qualification first for ABPM, and then which is the American Board of Podiatric Medicine, and then once you become certified, you take an examination. After you did the qualification, you do a certification exam, and then once you get board certified, you can actually advertise it on your card.
Okay. And that's something you have to keep up every X amount of years?
Yeah, you have to pay a dues and just make sure you...
and recertified every 10 or 12 years kind of thing?
Something like that, yeah.
Okay.
I actually have to check on that.
Yeah, but you are board certified.
They give you an email telling you, hey, you got to do this again. So that's usually my cue to know what to do.
He did the extra work. Dr. Sassine's location, his office practice location, is at 2100 East Sample Road, Suite 203, right over here in Lighthouse Point, Florida. Again, sassyfeetpodiatry.com. When I was asking you about some of your areas of interest, and we're going to go a little more in depth in them as well, with them as well, I should say, do you also treat Achilles injuries? Because there's a injury trending right now in the world of basketball in the NBA. Do you do Achilles as well?
I can. If there's something surgical, I'll go in either with me, or somebody who's just an extra pair of hands to help me out in the case.
But it's good to know that you have a network as well that you can use.
Definitely. Especially some people you were mentioning with basketball players who do a lot of PRP injection. I am in the process of getting that, but we can schedule it.
I was just asking because John Wall, the NBA player, he actually slipped in his home. So the NBA season's going on right now, but the report is out of NBCSports.com is that he slipped in his home, ruptured his Achilles, and now is out for the Washington Wizards. So I just saw that coming across and trending a little bit as well. But Dr. Sassine, chronic heel pain, plantar fasciitis, like you told us, laser nail therapy. Now this is interesting. You can do this in office. Do you actually? Is this for that toe fungus that we see kind of sometimes on a big toe? Or you said it could be any toe, right?
It can be any toe that gets infected with fungal infection. So what occurs is that a lot of times patients will have certain shoe gear, and usually it's either the big toe or the second toe that starts getting infected first. It's the longest. So there's like a micro trauma that develops under the nail plate, lifting it up ever so much, allowing the fungus that's around us or among us, the fungus among us, gets underneath that nail, infects the nail, and usually it's that longest toe, or the big toe that gets infected first. And we have several treatments for it. It's not usually just right away. I'll tell them all the options. So,
isn't there a I'm sorry to cut you.
No, that's okay.
But isn't there a treatment where you can take a pill for that? Isn't that one of the ways?
That is one of them. Popular one is Lamisil terbinafine.
Okay.
I prescribe it like 250.
Is that topical?
No, it's this is the pill.
Okay, that's the pill part.
250 milligrams once a day, and usually you take like a blood test before just to check on the liver enzymes in particular, and after every 30 days, take another blood test just to make sure there's no interference. I usually try to stay away from giving this if a patient has a history of, alcoholism, which affects the liver, or hepatitis C. I usually don't prescribe it at all with those type of people. Normally, I'll gear it toward either topical or laser as an alternative. So, which doesn't, especially with topical, doesn't have the highest efficacy compared to a pill form, according to recent studies. But it's a good alternative along with laser in case of patients having some liver issues. So.
Okay. The combination. Yeah. And how many, I know everyone's different, but how many in-office laser nail therapies would someone need to blast away that discoloration that we hate to see on the toes there?
Sure, yeah.
Because we are here in the sunny South Florida right next to the beach, And today's kind of a beach day. It was like 81 degrees. I couldn't believe it.
Yeah, South Florida has a lot of people with fungal nail infection.
Ugly feet.
Yeah. I'm trying to be as politically correct.
Yeah.
But
those are the ones they cut the nail, but it's still ugly. It's just that discoloration.
Yeah, so we do 8 treatments. I like to do 8 treatments for about 15 minutes to 20 minutes, depending on the severity. And that will be usually judged by me if I can, because, depending on the level of thickness of the nail plate, sometimes it requires a little bit longer, or I have to either grind it down just so that the laser can help penetrate it better, the nail.
Okay, nice. Again, it's Dr. Michael David Sassine. He's DPM, so that's a doctor of podiatric medicine.
Yep.
Did I get that right?
Podiatric medicine.
Podiatric. I've heard that word before and I messed it up. Podiatric medicine. It's sassyfeetpodiatry.com, 2100 East Sample Road, Suite 203 in Lighthouse. The Lighthouse Point, I should say, right over here in Broward County as well. Short drive from Boca Raton, Delray, as well, Coral Springs, Parkland. The number there at the office is 954-812-3683. Doctor, we have about 30 seconds before our break, so I don't want to get into the next topic. When we come back, I think I want to talk a little bit about common orthotics,
right,
and a little bit about sports medicine as well. But good to know that you're in the area. You're in your second year in the practice, you were telling me?
Just starting my second year, yeah.
Okay, great. And we're going to talk about skin cancer, too. I want to touch on that because, believe it or not, we're a couple months away from summer here, 3-4 months, and we'll be back into summer. So we'll take a quick break, and we'll be back with Dr. Michael David Sassine on the You and Your Doctor Show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met, we say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, South Florida. Again, Dr. Michael David Sassine is with us. SassyFeetPodiatry.com. Great website there.
Thank you.
2100 East Sample Road, Suite 203 in Lighthouse Point. As well, 954-812-3683. One of the things we didn't get to go in depth in before the break was
Sure.
wound care. I know that's a big thing right now, especially with the baby boomer population. So
Definitely
tell me
is.
why wound care is so important in podiatry, and to have a good podiatrist look over your wound.
Yeah, sure. So here in Florida, there's a large geriatric population. It's growing every decade, a lot of which people who are diabetic, who, unfortunately, for whatever reason, they're not very compliant, and many times their feet get numb, and coupled with a breakdown in skin, leading to an ulcer. Many times, how I normally like to conduct patients with these wounds that come into my office, I also work at a wound care clinic at Broward Health North.
Oh,
so
nice.
I'll send them over there, and I have a team of people there that also help me out, nurses, as well as myself. And a lot of times patients with wounds will require either debridements or maybe a graft, or unfortunately we try to, if necessary, surgically, which would usually involve removing the infected bone, provided that they have a pretty good blood sugar. Usually I like to do surgery. Ideally, you want to do surgery on patients that are somewhat still stable, but sometimes you can't avoid it. You have to do surgery.
Yeah, if it's dire circumstances, yeah.
Especially if it gets gangrenous, you have to amputate it, whether it's the toe or the whole foot. So,
yeah, so that's wound care. Another one of the great things Dr. Michael David Sassine does here. You mentioned Broward Health. Where else are you on staff at, or where else do you do surgery at as well? Because I know nowadays doctors have choices. There's a lot of ambulatory surgery centers, ASCs, and that's big because that can help the patient maybe have an experience outside the hospital, which we know is less chance of an infection.
Yeah.
Sometimes that is people walk right away. Not walk right away, but they can leave right away from that center after a few hours, where versus a few years ago where you may have to stay in a hospital overnight.
Yeah, I do cases at Surgery Center of Weston.
Love Weston, by the way. Neat area.
Yeah, it is. It's a new area, I think,
Yeah.
in developed city.
Cleveland Clinic's out there. That's a big area, yeah.
So I do there, and Broward Health North, which I mentioned. Also, Broward Health Medical Center, and I'm also on privilege with Holy Cross.
Okay. Broward Health North, that's the one on Sample.
That's
Okay.
where I do my wound care clinic.
Okay, so and your office is right over there as well.
It's very close, not even 5 minutes away.
Okay, that's great. And that's, again, Dr. Michael David Sassine's office, 2100 East Sample Road, Suite 203, Lighthouse Point, just a little bit east of 95 there, right next to Broward Health North on Sample Road as well. What age range of patients do you treat? Does that, is there a big variance there? And second part of the question, are you seeing more baby boomers, like you said, geriatrics?
most of the people I want to say are usually above adult age, 18 plus. However, I'm always open to see anybody that is in the pediatric level as well. That's fine. If, let's say, there's certain issue, pediatrically speaking, that I may not be sure about, I guide them direct to whoever the appropriate specialist is.
Nice.
Yes, can do whatever needs to be done.
Yeah, that's a huge group, so they have super specialists. Now, also, do I need a referral to see you, a podiatrist? How's that work? Do I have to go like my primary care and say, hey, can I go see Dr. Michael David Sassine, or can I just call you up and request an appointment?
Well, you can always call me up all the time, but unfortunately, when it comes to referrals, it's really dictated by the insurance, and how that works is that some insurances, I believe Humana is one of them, they require referral from a primary first to go see a podiatrist that's on that panel. Other panels, though, like Medicare, you don't need a referral, as far as I'm.
So, like, every case is different with you walking into your office. I mean, everything's different with insurance as well, so it's good to check. But again, it's sassyfeetpodiatry.com. There's a ton of info there. Or you can call Dr. Michael David Sassine's office at 954-812-3683, located in Lighthouse Point. Now, let's talk insurance. Very important question.
Yep.
So everyone's always listening about this. Do you take most major insurances? And if you do, list a few.
Sure, I'll list it. I take Medicare, Blue Cross Blue Shield, Cigna, My Florida Blue, AvMed, TRICARE, and Humana Military.
Perfect. 7.
Yeah.
That's great. You take a bunch, so that's really convenient as well. Now,
Trying to grow it a little bit more, but
yeah, definitely. So, again, Dr. Michael David Sassine, sassyfeetpodiatry.com as well. Let's go back to that laser nail therapy. So now that's actually not covered by insurance, but that's actually a payer procedure, but it's really needed. I mean, when people have that issue, the discoloration on their toes, that's something they definitely want off.
Yeah, unfortunately, as of now, insurances don't take laser treatment for onychomycosis or fungal nail infection. So this is an option for many patients that I have provided for them, that I like to have as like an arsenal in basically getting rid of fungal nails. Usually I like to couple it still with other therapies like oral Lamisil as well as topical, to try to like increase the chance of removing it for good. I also like to implement usually some type of fungal powder that the patient can buy over the counter, that will help limit the spore count in the patient's feet.
So you're treating it from a whole bunch of different angles.
Yeah, you have to, because fungal spores are everywhere. Unfortunately, and a lot of patients who are already susceptible to this are going to have this type of issue if they don't continue to treat it for quite some time. Even after the laser therapy session, it's still not a guarantee they're never going to have it again. They can still get reinfected. Even if you take the pill, you can still get infected, because the fungal spore count is still there. That needs to be treated. So
yeah, it has to be, excommunicated from the area there.
You really got to mitigate the amount of fungal spores that are in your shoe and your feet environment. A lot of times I advise, making sure you scrub pretty well the bathtub and the shower. Try to limit.
That's a good point.
Yeah, you have to try to decrease the amount of any potential areas where there's a high amount of fungal spores.
Especially when you've lived in the same house or the same area for a while, chances of bacteria are pretty high. That's why you have to, clean the bathtub and shower area and the faucets and everything. I mean, just what comes out of the faucet, you'd be very surprised. Yep. In South Florida, the sludge that comes out of the bathroom faucet. So bacteria is there. We do need, the good bacteria as well, but once it gets under your toes, you got to...
well, fungus as well as bacteria, yeah.
Yeah, you got to call Dr. Michael David Sassine's office, 954-812-3683. Another thing we have here in South Florida is a lot of sun, and skin cancer
Yeah.
is a big deal as well, because if it's not treated early, it can be a real issue. So is that one of your areas of interest as well?
Well, certainly we do biopsies just to rule that out. Normally, you can't really make a determination right away just by looking at it. However,
Send it to the lab.
Yeah, you got to send to a pathology path lab by either doing a shave biopsy or a punch biopsy, depending on how the lesion looks. And once the patient has cancer, I normally would like to have multidisciplinary type of group of doctors involved. So oncologists, dermatologists will probably be.
That's when you use your big network that you have.
Yep.
Right there.
That's pretty much one of the instances where I'll use networking is key.
We got about a minute here. One of the Bob Marley had melanoma under his big toenail and didn't really know it for a long time.
Yeah, he had acral lentiginous melanoma. That's correct.
Wow,
that's usually a genetic thing, though. Believe it or not, it's not even caused by sun exposure.
Unbelievable. What if podiatrists would have seen that? We'd still have Bob Marley probably today.
Yeah, possibly.
So go see Dr. Michael David Sassine if you have any issues with your feet. SassyFeetPodiatry.com, 954-812-3683. Thank you so much for coming on the program. It was great. We'll have you again.
Thank you so much.
See you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.